This is Jess Hoy, and this is chapter 2 of pre-op and post-op nursing. So in the last chapter, we left off here. Let me show you. All right, we left off here. So what are you going to be including in your pre-op handoff? We're going to be including any sorts of medication reactions like green pea to propofol. We're going to include any sorts of allergies. We're going to include any falls so that we can have successful recovery, right? All of this is for successful recovery. So the pre-op consent in page 307 is a disclosure of the diagnosis, why they're getting stuff, the nature and the purpose of the treatment, including risks, probabilities of unsuccessful outcomes, and then understanding. And this is all voluntary. Your clients should not feel coerced to having this particular procedure. Now, I say this having had patients' families do everything but grab their hand and sign the consent to be able to get things done. As the nurse, our job is to be the client's advocate. And as the client's advocate, we need to make sure that their procedures are voluntary. If for whatever reason they are unable to sign their consent, there are some different procedures that are specific to different state laws. So therefore there are different procedures specific to different facilities. And you'll be familiar with those as well. As a nursing student, you shouldn't be obtaining consent for things. As a matter of fact, as a nurse, we don't really obtain consent for things. We verify that the client has signed it, and we sign underneath that this is the client and they signed it. But the consent is actually obtained by conversing with the doctor. And so in that way, we signed it, that we're verifying that Joe patient is signing for Joe patient. And that's what we're signing. The person who is in charge of doing the education and the person who is in charge of explaining things prior to any sort of sedation medication is the provider. Medical emergencies can override the need for consent. If somebody comes in after a major trauma car accident and they are bleeding out of the femoral artery, that is going to be taking precedent over getting voluntary consent. There are times where we can have family members sign consent. There are times that we can consent over the telephone. Those laws do vary state by state, and they vary facility by facility. So you'll need to be really clear about what it is that's going on in your facility before you're helping get that consent signed in a medical emergency or when a person is unable to consent. There are times where we need to have them mark the site, and there are some facilities that will have the client initial along with the doctor. And there are some different rules, like if we're having an amputation, wouldn't it stink if you were supposed to have your right arm amputated because of cellulitis and infection and they took your left foot instead? That would be awful. That would be terrible and disgusting. So what a lot of surgeons will do is they will sign off, like they'll initial the site and the client will initial the site, and then that is considered the site marking for purposes for consent. But that way everybody's super crystal clear about what's happening with that surgery. And it's like clearly marked on the body. So if for whatever reason, all the paperwork gets lost and the computer shuts down and all that we can do is but we have to do the surgery, like we can do the surgery because we still have stuff marked on the actual person. So here's a situation for you to ponder. You are the pre-op nurse. And let's, Mr. Wiener Schnitzel, and I love that picture. Sorry, do I chuckle at my own jokes in my recordings? Yes, I do. So what I'm going to do here is I'm going to have you think about this particular situation, and I'm actually going to stop recording here because I'm going to move into interoperative. So I want you to take this opportunity at my hard stop to really take a look and a listen and explore these 3 bullet points before starting chapter 3. So this is the end of chapter 2, and I'm going to stop sharing, but I would like you to please explore that, and then we'll go into and then start chapter 3.